Hi everyone, hope that you've had a good week last week. Just wanted to go over some info for our summary from last week's work. We've spent a couple weeks talking about for-profit versus not-for-profit status. So I just wanted to kind of wrap that up. We kind of beat that down a little bit, so we won't talk about that much longer. But I just did kind of want to wrap it up. So obviously we talked at length, and you can see in my announcement this week too. We did talk at length about UPMC, and I know that some of you may work at UPMC or have worked at UPMC, this is certainly not an attack on UPMC by any means. So please don't take it as such. I know some people do, so please don't take that as an attack on them. As I said in the announcement, they're a really great case study for this discussion. So they're an amazing organization. I don't know what the Pittsburgh area would do without them. So by no means was this an attack on UPMC by any means. But I just did want to kind of wrap up the discussion. So obviously, in a state like Pennsylvania, there are for-profit and not-for-profit organizations. Where I live, actually in New York, it's where I am right now. All hospitals are not-for-profit by law. So it's interesting. In some states, there's a mix, and I think the majority of organizations in PA are not-for-profit. But there could be a for-profit hospital organization come in, but it's generally they're not for profit. But so the one thing to keep in mind is that there are those two sets of rules. So like I mentioned on the top of the slide here, those requirements of tax exempt status, that 501c3 that come out of the tax code, that's one element. So we have, you have to be a charitable, scientific, or educational operation. You have to be serving the public interest. There's a certain number of transactions that you cannot be a part of. And then that revenue ruling came out later that said, we need to, there needs to be a charitable organization. We need to be a charitable organization, and the IRS actually kind of altered their administration of that for healthcare to include a community benefit standard. So that community benefit standard talks about the provision of uncompensated care, the cost that is not compensated for Medicaid patients, and that's something that's come up with UPMC's community benefit because it seems inflated. What their Medicaid numbers seem somewhat inflated. To some, I can't say personally. I don't work there, never have, but that is something that's come up. And provision of services to unprofitable patients. So when we think about our community benefits information that you've talked about in the discussion boards this week, talking about doing those free clinics, talking about putting in place services for maybe psychiatric care, mental health care. A lot of those are unprofitable or free, obviously, like our free clinics. So those totally fit within this community benefit standard and exactly the kinds of things that would help your organization move forward and fit within these guidelines. In Pennsylvania, we have what's called the HUP test, which is another set of guidelines that have to be demonstrated in order to be considered a not-for-profit in PA. So if you're in another state, like here in New York State, I'm not positive what the state laws are here right now. It seems like everything's always in flux in New York, but depending on your state, there may be another set of standards that have to be met. So you have your guidelines in your own state, as well as those IRS tax codes and revenue rulings that have to be met for the federal government. So always a cadre of things that need to be met in order to get that benefit of not-for-profit status, because it does give you, obviously you're not paying taxes, which is lovely for your organization, but you also get other benefits You don't have to pay licensure fees. You don't have to pay different types of business fees. You can get bond revenue, bond yields, etc. So there's other things that come from that not-for-profit status that can help you, say, when you're looking to do a capital project, etc. So let's talk about the quiz a little bit. And if you have any questions, any further questions on any of those topics as we move forward, we're going to get out of the for-profit, not-for-profit realm and move into the reimbursement side now. But if you do have any questions, please just let me know. So people did really well on the quiz overall, but I did have a few questions that we can discuss. So the first one is the AHA argues that, and our answers are up here on the screen. The correct answer is the one in bold. The cost of bad debt, charity care, and losses to Medicare and Medicaid should be included in determining the amount of community benefit. So the AHA, in one of the discussions about the lack of this notion of community benefit and the lack of the IRS, their ability to administer it properly, etc. There's been that standard's been changing over time, and the American Hospital Association, the AHA, came forward several years ago and said, we really think that things like bad debt, so obviously the money, I go to the hospital, I incur a $10,000 bill, and then I don't pay it. That's bad debt. So things like bad debt, charity care, which generally charity care is included. That is that provision of services that is not reimbursed. So some of these things are included, but they're saying that all of it should be included. So those losses to Medicaid patients, that would be included. That uncompensated cost to Medicaid patients would be included, but your Medicare losses are not included in your community benefit. So what the AHA is arguing is that all of these things should be included, which is especially bad debt and charity care. I certainly think that should be something that should be included. And if you're providing services to patients that are on a governmental health care plan such as Medicare and Medicaid, and you're providing service less than cost, I would agree that should be included as well. So there's certainly some room there for discussion, and it's been some time since the AHA put that forward, but I don't see the IRS budging on that anytime soon, unfortunately. The next one, community benefits are narrowly defined to include. So this kind of relates back to the question that we just had. We know that from our discussion we just had, bad debt is not part of community benefit. Unfortunately, if you have a patient that, if I come in and incur $10,000 worth of services and walk away from it, that is not going to be included in your overall community benefit. Now, if I am part of your charity care program, maybe I've signed up for your financial assistance program, etc. That would be. But if I just came in, self-pay patient, or maybe I'm a commercial insurance patient on a high deductible health plan, and I'm not paying that $5,000 family deductible or whatever it may be. None of those things are considered community benefit if they are not paid. So general bad debt is not a community benefit. But that cost of charity care, so as we just discussed on that slide, as well as that uncompensated Medicaid cost. So the difference between what Medicaid is paying a hospital and how much it costs the hospital to provide that service. And as in the next few weeks, we'll talk a little bit about the difference between how much a hospital charges and how much it actually costs the hospital to provide those services. And there's a big difference there. You think about an aspirin. You give a patient an aspirin, likely the hospital is going to charge $1 for that aspirin, because there's a lot of cost that goes into that aspirin. Now it didn't cost the hospital a dollar for that aspirin, but that's how much they're charging for it, because there's a lot of other elements that go into the cost of that. So ultimately, you have to kind of dive down into how much did that actual aspirin cost, and that's how much you can represent in your uncompensated Medicaid cost. So, so our answer here is choices B and C: cost of charity care, and then uncompensated Medicaid cost. So the difference between how much did the item actually cost and how much did Medicaid pay you for that, and that's the difference. Now we get what's called a cost to charge ratio through our cost reporting process in the hospital world, and that's how we can figure out those costs in the long run. Last question. Tax-exempt status eliminates the burden of tax liabilities and our answer here is most business and licensure fees. So that's obviously the tax liability is the biggest one, but of the other options here, our answer would be the business and license fees, which is can be burdensome for a large organization as well. So, so that is what I have for this week. If you have any questions, please just let me know. But otherwise, I will look forward to seeing everyone on the discussion boards this week. Thanks so much.